Hi, my name's Georgia from BN Australia. I'm a physiotherapist and expert in pelvic floor physiotherapy, and today I want to talk you through a technique for vulvodynia that helps to desensitize the tissue at the entrance of the vagina. So if you haven't already figured out where exactly your pain is around the entrance of the vagina or the vulva, then you can go ahead and watch our video explaining how you can do a self-assessment on yourself. But assuming you know where the most provocative areas are for you, these techniques can be applied from there. So we're going to focus around the entrance of the vagina just because that's mostly where people experience pain, but if you're experiencing pain in other locations, you can apply the same techniques there. So using a good quality intimate gel or lubricant, we want to make sure that it's non-irritant. So make sure you've tried it before you start using these techniques. We don't need any additional stinging to add to the area. So our BN intimate gel is designed to be really low irritant and really good for something like this. So with a pea-sized amount on your finger, we're going to start to lubricate up the entrance of the vagina. So you've separated the labia, and we're starting to just really gently run our finger around the entrance of the vagina with the lubricant. So the lubricant will decrease friction, but the movement will add a little bit of friction. We want really gentle pressure. We're not trying to stretch the area. We're not trying to apply too much pressure. We're literally just getting the nerves and the skin rather used to some pressure and some touch around the entrance of the vagina. For some people that can be really not that threatening, not that uncomfortable, and for other people this could produce burning, stinging, stabbing pain. So depending on where you're at will depend on how long you'll stay there. So you might do that every day for a couple of weeks. You might only need to do that once and then you can move on, or you might need to do it for a couple of days. It really depends. The next step up from that is then, still with lube on the finger, to insert it into the vaginal canal. So we're going about 1 centimetre into the vaginal canal, and we're aiming to move our finger in a U shape up and down the sides of the vagina, down to the base, and then back up the side, with again gentle pressure, because the aim here is just movement. You can also use a size 1 or size 2 dilator for this, using just the tip at the entrance of the vagina and running it up the sides, down to the base, back up to the side at the entrance of the vagina. It gives you a little bit more flexibility because of the medical grade silicone, and it also gives you a little bit of a longer lever, so sometimes it makes the relaxation part a little bit easier. You can then also progress the penetration section, which is the next part, if you're already using dilators. So it can be a really handy tool to use for the vulvar desensitization, as well as your return to penetrative intercourse. So you're just getting the skin used to that friction up and down, up and down. And again, you might progress past that quite quickly, or it might take you a little bit longer. If you think you need to, you can also use other surfaces. So using something like a face washer or a Q-tip or a cold spoon or anything that's going to add extra stimulus to the entrance of the vagina. And again, you would just apply that sensation to the outside of the vagina and the entrance of the vagina, so the vestibule. You're not trying to rub it raw, you're just literally trying to get the nerves used to the sensation, used to something touching it, particularly if something like wearing tight clothing is bothersome. That rubbing back and forth can sometimes be really irritating to the nerves and to the skin. Once you're okay with the entrance of the vagina, if the aim is to go back to pain-free penetration, you might then use the dilator to insert it all the way into the vagina, and then you might be twisting it side to side or moving it in and out. That will create a little bit of friction at the entrance of the vagina, but sometimes the internal vaginal mucosa is also sensitive, so we're getting the whole vaginal canal used to that sensation. As you move from size 1 up in your dilator range, progressively there'll become more of a stretch at the entrance of the vagina, and therefore moving it forward and back or in and out will provide more friction to the entrance. And all of those things are really good progressive ways to build up to something like penetrative intercourse, because you're in control, you know that you can stop whenever you need to, and you're in control of how deep you go, how fast you go, and how much movement you provide yourself. So those are the really nice progressions that you can use to get the entrance of the vagina, the vulva, and the vaginal canal used to touch, pressure, and penetration again. When you're treating vulvodynia, we never want to just focus just on the vulva or just on the vagina. We want to look at your breathing mechanics, your hip mobility, your lower back mobility, how you react to pain, and how you tense your body in response to this. So check out some of our other videos linked below to see if there's anything else you could be working on in conjunction with this to make sure you've got a really holistic treatment program. So for more information, you can head to bn.com.au and let us know if you have any questions.